paradoxus. Pulsus paradoxus is a FAQ, frequently asked question, not only for the Viva but for your practicals also. Frequently asked question. So frequent Venki back phenomena we will come there, that will be in the AV blocks in the arrhythmia section. So pulsus paradoxus. So the pulsus paradoxus is pulse and pulse apex deficit is same. Pulse deficit means difference between heart rate and the pulse rate. That is the meaning of a pulse deficit. Now pulsus paradoxus. So the we have done in the yesterday class that during the inspiration and expiration the blood filling of the heart varies. So with that again recalling back the same basics again, remember during the expiratory phase left ventricle blood is more. Left ventricle blood is more, that means stroke volume is more during the expiratory phase, and if the stroke volume is more, systolic BP will be more. Stroke volume is more, systolic BP during expiration is increased comparatively, while inspiratory phase the left ventricle blood is reduced, stroke volume is reduced. All of that we have done in the previous class. Inspiratory phase, left side of the blood is reduced. As a result, the systolic BP during inspiration is reduced. This is normal. This is a normal physiology. So if we take this is also normal. So the conclusion is, if we take systolic BP during expiration minus that from systolic BP during inspiration, it will come out to be 0 to plus 10 mm of mercury. So systolic BP during expiration is slightly more than the systolic BP during inspiration. So even in a normal individual there is a difference, and that difference is up to plus 10. That is up to plus 10. So what is the meaning of the pulsus paradoxus? Pulsus paradoxus means if systolic BP during expiration minus systolic BP during inspiration is more than plus 10, this is the meaning of a pulsus paradoxus. So both words are wrong. They are wrong. Paradox is opposite response, but here it is an exaggeration of a normal response of the body. It is an exacerbation or the increase of the difference, not the opposite. It is mainly appreciable in BP rather than the pulse. It can be seen in the pulse, no doubt, but it should be very severe enough. So mainly it is assessed in the blood pressure rather than the pulse. So pulsus paradoxus, both words are slightly wrong, but still it is used. So when will this difference be more than plus 10? So we will apply a simple mathematic here. The difference will be more than 10 either the systolic BP during expiration is increasing more than the normal value, or the systolic BP during the inspiration is reducing more than the normal value. There are two possibilities mathematical, either expiratory BP increase or inspiratory BP falls down. So the main mechanism during inspiration, pulse pressure increase. We are talking about blood pressure here. We are talking about the systolic BP here. So, and I have never told you that during the inspiratory phase pulse pressure increase. No, I have not told you anywhere. So the main mechanism is a double arrow reduction in double arrow reduction in systolic BP during inspiration. That is the main mechanism. That is the main mechanism. Marked decrease in the systolic BP during inspiration, and that occur due to marked decrease in left ventricle blood filling during inspiratory phase. So this is the reason. Double arrow reduction in left ventricle blood filling during the inspiratory phase. More blood filling is there reduced, so the more reduction in the BP will be there during the inspiratory phase. So this is the main mechanism that you need to know about the pulsus paradoxus. Our BP is 120 by 80. Then during why air does not go inside the blood, as air has a pressure of 720. Because very simple, there is no direct communication of the blood vessel with the atmosphere. Blood vessels are not ruptured, they are intact structures. So when they are intact structure, how will the air will go inside them? Now coming to the causes. So the causes here are causes. So number one cause is non cardiovascular causes. Non cardiovascular causes, and remember that one word, and that one word is hyperventilation. Hyperventilation. So hyperventilation is during surgery. If the vessel is cut, it has to be immediately ligated, otherwise patient will die from bleeding. So it is not left open, it is immediately ligated or corrected. Now hyperventilation. So the hyperventilation is, and also Abhishek, for your information, when the blood vessel is cut, it has got such a high pressure ki if it is not corrected, so individual can die within minutes. Now hyperventilation. So why hyperventilation? Because during the hyperventilation there is a negative intrathoracic pressure, so there is more pooling of blood inside, more pooling of the blood inside the pulmonary vessels. More pooling of blood inside the pulmonary vessels. Why? Because pulmonary vessels are dilated by the expansion of the lungs. So when they dilate more, so more pooling of the blood happens inside them, and when there is a more blood pooling inside them, decrease blood goes to left side. Left side of the heart. So there is a pooling inside the lungs. So hyperventilation, why the hyperventilation occur? So this physiology fundamental you can make clear that respiratory centers are stimulated because of either the high PaCO2 or low PaO2 or low pH. Low pH. These are the conditions which stimulate the breathing center as well as progesterone. As well as the progesterone. So anything which is causing a hyperventilation is a reason for a pulsus paradoxus because of the more pooling of the blood inside the pulmonary vessels. So the high PaCO2, the clinical examples are exacerbation of COPD or asthma. Indeed, this is the most common cause of pulsus paradoxus. Most common cause of the pulsus paradoxus. Low PaO2 hypoxia stimulate the respiratory centers, and hypoxia stimulating the respiratory centers, it will be a case of say a pulmonary embolism. Low pH metabolic acidosis. Metabolic acidosis, you know that breathing, hyperventilation breathing is small breathing, all of you know. Progesterone. Progesterone directly stimulate the respiratory center. It is the property of the progesterone, and progesterone is increased in pregnancy. So progesterone stimulate respiratory centers. Pregnancy. Now the cardiovascular causes. This is AXA exacerbation. Exacerbation of COPD. Now the cardiovascular causes. So in the cardiovascular causes, there are three important causes. So we need to understand the first the physiology. So if we look at the first the physiology of a ventricle filling. So this is a simple diagram to know the normal physiology during the inspiratory phase. So focus on the inspiratory phase mainly. Blood, this is right ventricle side. This is left ventricle side. What is meant by exacerbation of COPD asthma? Acute attack. Acute attack of COPD and asthma. These are chronic condition. Patient was stable and then patient has an acute attack. More exacerbation of that respiratory abnormality. Pulmonary embolism. Pulmonary embolism is a cause of hypoxia. Is a cause of hypoxia. So now let's see this diagram. During the inspiratory phase, there is more blood which goes into the right side of the heart. So double arrow. This blood, double arrow. Now, how this right ventricle accommodate that large amount of blood? Very simple. Right ventricle wall is a thin structure relatively. So during the inspiratory phase, when relatively more blood enters the right ventricle, there is a dilatation of right ventricle wall. So right ventricle wall normally dilate to accommodate this extra blood. This blood will be accommodated like this. So septum remains central. Septum usually does not move. Septum does not move. It remain in the center. So whatever extra blood has come into the right ventricle, that blood is accommodated in the right ventricle, because right ventricle wall normally dilate. Septum remain in the center. This is a normal phenomena. Now, what will happen if right ventricle wall is not normally able to dilate? So the mechanism here will be, if right ventricle wall not able to dilate during inspiratory phase, right ventricle wall is not able to dilate during the inspiratory phase. So what do you think, what will happen? What will happen during the inspiratory phase? How will the blood, extra blood in the right ventricle get accommodated? How it will get accommodated if right ventricle wall is not able to dilate during the inspiratory phase? So think and tell me what will happen in that scenario. And that will be your causes here. The causes, cardiovascular causes. Septum moves towards the left ventricle. Yes, very nice. The septum will bulge into the left ventricle cavity. So if the septum deviate into the left ventricle, what will happen? This will lead to septum, interventricular septum bulge into left ventricle. That means left ventricle blood will double arrow reduce during inspiratory phase. So that make the criteria for the tamponade. That will make the criteria for the tamponade. Yes, the left ventricle blood will more reduced. It will more reduced. So the number one condition here is, this condition is pericardial fluid compressing right ventricle from outside. So there is a pericardial fluid, and that pericardial fluid is compressing the right ventricle cavity, so it will not allow it to dilate. That condition is known as, very important, we will discuss later on also, this is known as cardiac tamponade. So what is the meaning of a cardiac tamponade? Cardiac tamponade is a pericardial fluid. It is a pericardial fluid which is compressing the right ventricle from outside. From outside. So this is the most common cardiovascular cause of pulsus paradoxus. Now the second condition, identify. The basic mechanism remain the same, the mechanism of a cardiovascular cause. Why only right ventricle? Reason is very simple, and I have told the reason in between. Catch my words very carefully. So, right ventricle has thin wall. Remember, right ventricle has thin wall, and pericardial fluid will compress the thin wall structure. It does not compress the left ventricle from outside because left ventricle has thick walls. Now, number two, let me see who can give me the correct answer here about this etiology. Number two, there is a failure of relaxation. There is a failure of relaxation of heart due to stiff pericardium. So, this is a stiff pericardium. For example, this is right ventricle, left ventricle. So there was a stiff pericardium, stiff and calcified pericardium from outside. This is stiff pericardium. Stiff. Stiff means thick and calcified. So what will happen? The blood which is coming here, extra blood which is coming here, the right ventricle wall will not able to dilate. So this extra blood will cause a septal bulge into the left ventricle like this. Constrictive pericarditis. Very nice. So this is a case of a constrictive pericarditis. Constrictive pericarditis. So understand these meanings carefully, these pathologies carefully, because they will come in subsequent parameters also. Now identify what is this. Exactly same pathogenesis as constrictive pericarditis, but the layer is different. Failure of relaxation of the heart due to stiff myocardium. Due to a stiff myocardium, so the heart is not able to relax normally. Almost the same pathogenesis as constrictive pericarditis. So the visualization here is this visualization. Stiffness is from inside, the myocardium is stiff. Myocardium is stiff. So obviously when more blood comes here, right ventricle will not be able to relax, so septum will bulge into the left ventricle like this. Yes, this is a case of a very nice restrictive cardiomyopathy. This is a restrictive cardiomyopathy. But restrictive cardiomyopathy is a rare cause out of the three condition of the heart as a cause of a pulsus paradoxus. Why it is a rare cause? Because reason is for restrictive cardiomyopathy to cause pulsus paradoxus, septum should be flexible. septum should not be stiff. If the septum is stiff, it will not move. So, septum should be free from stiffness in restrictive cardiomyopathy to cause a pulsus paradoxus. Pulsus paradoxus.